All right, yes, I'm ready. At the time I'm speaking at this event tonight, there are over 12 million confirmed cases of coronavirus and more than 500,000 total deaths. The COVID-19 pandemic is considered the most crucial global health crisis of the century and the greatest challenge that humankind faced since Second World War. According to official reports, the largest number of confirmed cases are located in the United States, Brazil, Russia, and India. At this point, everyone has questions. How long will this pandemic last? Will there be a second wave? And most importantly, what are we doing to fight this pandemic? Since this is a very new virus, much knowledge about this novel virus is therefore not available. Currently, there are not exact antiviral treatments or vaccines to treat this disease. Therefore, it is an urgent necessity of time to develop a safe and stable COVID-19 vaccine. As most of the world has now gone into a lockdown, the entire scientific research community has gone into an overdrive, trying to understand the nature of the virus, as well as the way that it spreads. A little publicized fact is that progress is being made with a little help from technology. Personally, I've been closely monitoring this technological progress the past few months. As a researcher and engineer, I've had the opportunity to learn and work directly with healthcare professionals, transforming obsolete processes in a hospital to optimize results. Now, let me explain you why I've been doing that. It was September of 2019, and I was on the phone with my sister, who happens to be a doctor, and she was telling me a story about her work. Her entire story focused on how challenging her work is, as she must look at hundreds of x-rays every day. And I asked her, what if you make a mistake? What if you miss something? And she said, there's no room for error. We all work together as a team and review everyone's work to make sure the diagnosis is correct. Those words keep rumbling in my head. And so I decided to work on a solution to help them. But I knew nothing about CT scans or x-rays or diseases. I had to do a lot of research to understand the basics of these images and some of these diseases to actually start building something. Long story short, I found a solution. I trained an artificial intelligence model that detects diseases. I worked collaboratively with my sister and her colleagues to build this solution. The project was approved by the hospital, and we expect to implement this solution soon and save many lives. At this point, you might wonder, but what is artificial intelligence? It can be defined as machines imitating human intelligence. It can also be defined as building machines that are smart. So this happens when machines make decisions or apply reasoning. But aren't computers smart already? Here's an analogy that I once read and liked to explain what artificial intelligence is. Imagine the following scenario. You show an apple to a kid and tell her, this is an apple. Repeating it for over 20 times, a connection in her brain establishes and she can now recognize apples. Here's another similar example. You show a dog to your baby daughter and tell her, this is a dog. She now knows what a dog is and identifies it as a dog. A few weeks later, a family friend brings along another dog and tries to play with the baby. Your baby has not seen this new dog before, but she recognizes many features. 2 ears, 2 eyes, walking on 4 legs, the nose. She recognizes this new animal as a dog. She was not taught that it was a dog, but she learned from the data. In this case, the data about the dog. The same process happens in artificial intelligence. You train a machine, the machine learns from the data and then produces an output. For example, you can train your machine to identify dogs and images. You can load thousands of images to your computer, and then the machine learns to recognize the dog in a picture. You can also train your machine to identify other things such as Alzheimer's, cancer, kidney stones, strokes, and many other diseases. The process is the same. You train a machine, You load thousands of images. In this case, it could be X-rays, and then the machine learns to recognize those diseases in an X-ray. But how is artificial intelligence helping us with the pandemic and the impact of COVID-19? Well, in fact, from the very beginning, AI has been helping us behind the scenes in this massive endeavor, a system with the many limitations of human knowledge. For one thing, AI increases the types of testings that we have available. There are different artificial intelligence programs that can detect log anomalies in an X-ray and then provide a COVID-19 risk evaluation much faster than human radiologists. And beyond personal healthcare, AI has also been used to track and flag possible carriers of the virus. Organizations and governments have adopted artificial intelligence to detect people with fever in large crowds. Using these smart glasses, they can scan hundreds of people within minutes. According to Accenture, the investment in this sector is gonna reach 6.6 billion by 2021, which is an actual annual growth of 40%. This year will be a breakout year for AI. AI will also help ensure we're better prepared for the next pandemic, but we will need doctors, scientists, policymakers, and investors to collaborate. Hopefully, we won't just use AI, but real, actual human intelligence to help us move ahead and take care of each other. Thank you.